All right, so now that you've had your didactic block, you've had your first semester, I wanted to just quickly review your SOAP notes, how to define or develop your differential diagnoses, and then also an introduction to coding. Hopefully you've all had at least one day in clinical. But again, as you're putting together your TIFON and you're writing your SOAP notes, I wanted to just kind of review how to ensure that you're writing appropriate documentation, because it's so important to record everything that's happening during the visit. Your SOAP note should be a record of what you heard, which is your history. What you saw during the exam, which is, again, your exam. And then your thought process, which is your medical decision making. Now you'll understand. So your SOAP note, again, you're going to have the chief complaint. If you can actually write it in, your patient's, like their own words, you can put your quotes around it. And then your HPI is going to be your history of present illness. So again, this is where you're including everything from old carts. And I have the note here. So your onset, location, duration, characteristics, your symptoms, aggravating, alleviating, things that you've done, treatments that they've tried. And we're going to talk about what the difference is between a brief and an extended HPI and how that plays in again into your coding. And again, here for your presenting, for your chief complaint, it's going to be your presenting problem, but it may not actually be the primary problem that you take care of later. So say somebody comes in and they say they're complaining of cough and cold symptoms, and then you find later on that they're wheezing. Your primary problem is going to probably be like asthma or wheezing, but their chief complaint was that cough that they came into the office with today. So I thought this might be helpful, again, if you need that review of your history of present illness. So you see, old carts kind of listed out a little bit differently than I had on the previous slide. And then the two types of HPIs that I was mentioning, so brief and extended. So brief HPI is going to include 1 to 3 elements. So here, for instance, patient complains of headaches. It's a dull ache in the left ear over the past 24 hours. Versus an extended HPI, the patient is complaining of dull ache in the left ear over the past 24 hours. States he went swimming 2 days ago. Symptoms are somewhat relieved by warm compress and ibuprofen. You can see there the big level, the big difference in terms of how they documented the HPI and how they're including those different elements. The other component that you're looking at is going to be the past family and social history. So again, you're going to want to include different components of this depending again on the level of your visit. So past history is going to include any experiences with illness. Family history is going to include that review of medical events, diseases, and hereditary conditions. And then the social history is like the age-appropriate review of current and past activities. So again, you have a pertinent history that's going to be related to the problem, and you must have at least one of these 3 areas documented. And then here you can see again an example of the past surgical history that's being included. So a very typical child sick visit, for instance, is going to include no allergies, whether or not they're taking any meds, and whether or not they've been exposed to anyone sick. Another thing that you can include here is attending daycare, so I'll include that here as well. So your review of systems is still part of the subjective part of your note. So again, if you start looking at the different components, you'll see how all of this flows together. And you want to do a review of systems that's pertinent to whatever it is that you're discussing. So these are examples of what you can include in a review of systems. But again, you're going to include those components that are pertinent to yours. And we'll talk about the number of review of systems that you need to include in your notes. So here, you can put a statement at the very beginning that says pertinent positives noted in HPI, remainder of ROS as follows. And these are all, denies or negative for different things. And then you have these 11 sections that you can think about, and then also endocrine, hematologic, and allergic. Now, typically in your sick visits, what you see here are mainly what you're going to be dealing with. And an example, for instance, of an extended review of systems. So I'll just put here. So I've put a note here. In an extended review of systems, you're going to include 2 to 9. In a complex visit, you're going to include at least 10. So those people that are in specialties, they might be more inclined to use a complex or, needing at least 10 of the different systems. But again, for most of your visits, you're going to be getting the extended 2 to 9. So you always want to make sure, again, depending on the type of visit that you're dealing with, have you checked for fever? So if it's not included in your HPI, ask, have you experienced any fever? For HENT, denies congestion, changes in vision. What about denying ear pain? If they come in with ear pain, for example, denies discharge from the ear would be another thing that you can include there. And again, if you're talking about a GI issue and up above, they're talking about abdominal pain. Have you ruled out that they're denying nausea, vomiting, or diarrhea? So again, some examples here of different things that you can include in your review of systems. So examples here again are your problem pertinent review of systems and then your extended review of systems. So here, say you have a chief complaint of earache. Your HPI would include your onset, location, duration, all of your old cards, and then your review of systems, positive for left ear pain. Again, if you had that statement in there saying pertinent positives noted in HPI, you could leave that piece of it out, but they're denying dizziness, fullness, or headache with that ear pain. So again, an example, and then down below you see kind of a more extended review of systems. So now we're moving into the O part of your note, which is your objective. And again, for pediatrics, you always want to include your vital signs, and that's part of that constitutional general review. You want to include, again, that counts as one area if you have 3 of your vital signs. Things like BP are important if you're measuring, if you have somebody coming in with headache, what is their BP? For most sick visits, do you include BP? It depends, again, on what your kid is coming in with. Temperature is generally a good one to include, their latest weight, and then, how they look when they come to see you as well. And then again, we're going to talk about how many of these areas need to be included for your notes. Generally, again, we've talked about this before, kids are so complicated that you really don't want them coming in to see you and not checking their cardiovascular, their chest, and their abdomen. You want to just lay your hands, lay your stethoscope on them, make sure you're listening. Part of that is you don't know the continuity of care, how often they're coming in. And then, a kid might come in complaining of abdominal pain, and you want to make sure that you're ruling out there isn't some sort of otitis media going on. And then when we talk about the differential diagnoses, you'll see why, again, you want to make sure that you're including a lot of this. But those are really the important parts of your note that you want to make sure that you're including. So we're going to talk a little bit more on the next slides about the different components of your physical exam, and then what, again, is going into determining what level of note you're writing. All right, so now we're moving into the A part of your note, which is going to be your assessment. And we're going to have a couple of slides where we talk about differential diagnoses. But, again, you want to think about all of the possibilities and how you're using your exam and your history to either rule in or rule out different diagnoses. And then your plan here, you want to make sure that you're addressing everything in your plan. So your A and your P. And what we found helpful for our notes, again, you'll see in the template, is that after you come up with your diagnosis and your plan, then you're going to put your rationale in as to why it is that you chose what you did. And here you can see that the person used Burns as their reference. And again, I think it's a great way to kind of review those different diagnoses that you're writing your notes on. So for this particular note, we've kind of been following it all along. It was an eye issue that was going on. And this is a very simple table that you can complete on your differential diagnoses. And in this particular case, this person is organizing it by environmental issues that could be going on, endocrine issues that could be happening, infectious, inflammatory, neoplastic, and traumatic. Now, some of these are very obvious, like, kid comes in with a swollen eye of some sort. But again, it's the thought process that you're going through. And as you're learning about these issues, it can be very, very helpful to put yourself and organize it in this way. So for environmental here, she's listing spider, insect, animal bite. Key findings: there were no pets. They didn't have a recollection of animal bites. It's if it's an environmental allergen, thing that's going on, it's not bilateral. There are known allergies. So you can see here again, from the components that she's written about, what she got in the HPI, what she did in her review system, she's really starting to narrow down. Under infectious, for instance, here, it could be viral or bacterial. She wrote the top etiologies for the bacterial infections that it could be, and then fungal. And then here for key findings, was there any exudate? Is there a need to culture? She could have put those positives that she's noting in her review of systems and HPI under here as well. For inflammatory, conjunctivitis, is it discharge? Is it, is there bilateral stuff going on? So again, it gives you a good sense of how she's organizing. And really, for any one diagnosis that you're thinking about, you can think about environmental issues, endocrinology, type things that could be affecting it: infectious, inflammatory, neoplastic, or traumatic. We always think of it as, you don't want to always think about the zebra when it most likely is a horse, but you don't want to miss a diagnosis is really the biggest thing at this point in your careers. Now here's where we're going to start talking about your note and what components go into differentiating between something like a 99213 and a 99214. So we're going to talk about the decision chart here and how you go about each one of these visits. So again, a typical 15-minute visit is going to be a 99213. And as we go through, I gave you the key of abbreviations here. For a 99213, you're going to want that extended problem-focused history, an expanded problem-focused exam, and then it might be a low complexity decision-making. And just to give you some idea, I did include slides at the very end of this, but typically in pediatrics, for a typical visit or a typical office, 70 to 80% of your visits are going to be 99213s. So again, if you can think about the components that go into this, it'll make things kind of, I think, flow a lot better. So we'll go through each one of these components individually. All right, so here we're talking about the history. So that was a very, very first level that we were looking at. And I mentioned to you that if you're doing a 99213, most likely you're going to need the expanded problem focused. So your HPI, again, go back to that slide where I talked about, the 3 elements that you would need. Now, again, a more comprehensive note, you might have more than 3 of those elements. So for an earache, for instance, if you're really capturing, the essence of what's happening with that ear, you're probably going to end up with more than 3. Your review of systems, you want to have at least 1 that you've included there. And again, if you're going through your HPI, are you capturing whether or not they had a fever? Are you capturing whether or not they had ear discharge? You can see how, again, you're getting to that level of 2 to 9, and then your past family and social history here, just asking about allergies, asking about whether or not they've had other sick exposures, are they in daycare? Again, you've met those needs. And you, in a note, if you're in a place where you have continuity of care, then you can always say, the history has been met, in previous visits. But again, it's never a bad idea to just ask about those sick contacts, allergies, and then whether or not they're in daycare. But again, you see all of those different things, elements that are listed there. So what I've done in these next couple of slides is show you the different systems and areas. So again, going back to that 99213, you wanted to have the expanded problem focused for your exam. So you're going to have systems and areas, at least one, and then some of the bulleted elements. So as I mentioned before, if you're doing just your basic exam, you're going to hit all of these things because you're listening to the respiratory, you're listening to the cardiac, and then the abdominal will be on the next slide. Oh, here it is. So you're doing all of those components. You're going to hit, again, those elements for the expanded problem focus. And then here again, gives you some of the examples to include for your multi-system exam. So again, constitutional, any three of your vital signs, that is going to be one of those bulleted elements. General appearance of the patient. So again, all of these things, you might be asking yourself, well, we're doing a lot more than what's expected for the expanded problem focus. Why are we not coding higher than a 99213? And we'll get to that in just a second, but it's a really good question if that's what you're thinking. But again, a very thorough exam, it doesn't have to take long, but if you have those components, you're always going to hit that minimum that you need of the expanded problem focused, and you're doing an excellent exam. And here I included for you as well the rest of those, body systems and then the bulleted areas underneath to give you an example of, what is counted when we're talking about those exam elements. So the system areas, being like the GU, and then the bulleted, examination of the scrotal contents, examination of the penis, digital rectal examination of the prostate gland. Again, all of those are the bulleted elements underneath that system. So here's that complicated piece. So we've already talked about, again, the history pieces, and then again, if you're seeing, mostly 99213s, your expanded problem focus, and then here you see, your established patient, your whether you're doing a detailed exam, and I've given you examples, of some of those things. We're moving into the decision making. So here again, there's a difference between a straightforward visit, a low complex patient, and then the medical complexity and the time issue. So, I can't code all of my visits, for example, 99214s, because that would essentially mean that I'm only seeing 2 patients an hour versus 4 patients an hour. So all of these things are kind of playing into one another. But we'll talk about the different components that go into this, but you're talking about, how risky is the diagnosis of your patient. So whether it's a low risk or a moderate risk, we're going to be talking about how many diagnoses are there, what types of management options are you talking about? Are there prescription meds that are involved in, what's going on with your patient? So I alluded to this already, but again, the number of diagnoses that you're talking about. So in a straightforward visit, you have minimal amount of diagnoses. The complexity, like what's going on, and we'll talk about this a little bit more in the next slide. But, again, for the differences between what you're looking at low complexity and moderate complexity. So the risk level, for instance, say it's one limited minor problem, and management options are rest, gargling, elastic bandages, superficial dressings. Those are going to be the types of visits that you might see like at a minute clinic, which are very short and to the point. Low complexity is going to be a self-limited minor problem. Maybe you're dealing with a chronic illness or an uncomplicated illness. So again, here, are going to be your URIs, your colds. And then you start moving into, different issues when you're talking about like moderate risk here. For some of you that are in the ER or that might be seeing more complex patients, pyelonephritis. So this is a little bit different than, let's say, a UTI. Or a complicated head injury, that would fall into this. There's some discussion about, where would an acute otitis media fall? Is it going to be more of a low risk or a moderate risk? And when you're in your clinical settings, those are the types of questions that I think are very appropriate to ask your preceptors, because you start again in your head differentiating between what you're doing. Now, what we've seen, and like what I've mentioned before, is that 80 to 90% of your visits are going to be that 99213. And over the years, we've seen more people coding at the 99214, but whether or not it's appropriate is the question that comes into play. So again, it kind of gives you an idea there of what you're doing. But again, the risk level, so for an otitis media, it can be a pretty straightforward, you can do it within 15 minutes. You're going to prescribe a medication. There's some differences as well. Like, are you using over-the-counter meds? Are you using prescription meds? I don't think it's always the best, kind of measure to go by, because in some people you'll hear say, oh, well, if it's a prescription med that's required, then it's going to be a moderate visit, or moderate complexity. Again, there's some wiggle room there. So I wanted to include this slide because, again, it shows you the distribution for most typical practices. So in 2003, we had more people using 99213s at that 80% level, and it dropped a little bit in 2007. And then we saw a drop in the 212s. And again, you can see how you wouldn't necessarily want to code things at the 212 level, because for those comprehensive visits that you're doing, and again, this changes among like different specialties. So again, a CVS clinic might be using more 212s, a typical pediatric practice using more 213s. I included this last slide just so that you could see kind of the difference between what's happening. So dermatology here was seeing more 212s. Internal medicine, they weren't using any 212s. They pretty much had a 50-50 split between their 213s and 214s. But, again, in the different specialties, you see a huge difference in terms of like what they're using in terms of level 5s. So pediatrics isn't listed here, but you kind of have the distribution of like nurse practitioners and there that I just wanted to include, and it's really more for your information. Hopefully you found that helpful. I'm going to be posting the exemplar for the SOAP note that I really want everyone to use. And again, it's to ensure that you're kind of following that format. Start thinking about your differential diagnoses. And then as you're coding, check with your preceptors and check to see whether or not you think your visit's falling into a 213 or a 214, and see if you can start identifying those components that play into it. And I think the biggest thing too is that, never forget that your documentation really needs to capture what it is that's happening during that visit. And it's part of the medical legal documentation behind, what's happening. So you want to ensure that all of those components are there so that any reader that comes behind you can follow your train of thought and again, see, kind of what's happening. And it doesn't, again, the time component, now as a student, you might be taking a little bit longer, but again, it's, what a typical provider for most of these visits is going to take. But I hope you found it helpful and have a great day.